I'm Dr. Sandeep Jha. I'm a liver disease specialist and a liver transplant surgeon, and I work as a consultant at Manipal Hospital, which is in Dwarka, Delhi, India. Over the years, I've interacted with thousands of patients of chronic liver disease and cirrhosis, and I've been involved in more than 500 living donor liver transplant over these years. One of the most frequent questions that is put to me is, Doc, I have cirrhosis. So what kind of diet should I have, or what kind of dietary plan should I follow? Now, if you look at dietary recommendations over the internet or in the public domain, they are very confusing, and it really confuses the patient to what should I have or what should I not have in order to help in cirrhosis. Even when you look at it, we are also confused. However, when you talk to a doctor or medical personnel, we look at diet not as bread or bacon. We look at it as carbohydrate content, protein content, fat content. We calculate the calories and we look at the glycemic index. That's how doctors look at it. That's how medical personnel look at it. That's how scientific literature defines diet. However, for the general public, it can be very confusing, but we are very lucky to have a lot of information these days on all food items where they mention carbohydrate, protein and fat content and calorie content. And so you'll have to do a little homework to convert these dietary recommendations from scientific publication to your daily diet that you take. And it should not be a very difficult task, I guess. So cirrhosis is a state of malnutrition, and this malnutrition can lead to sarcopenia, which has increased risk of complication, infection and mortality in these patients of cirrhosis. So it is very important to prevent malnutrition in such patients, and this can happen very early in the stages of cirrhosis. Now, in normal individual, what happens that when he takes a meal, the excess carbohydrates or proteins is converted into glycogen, and then it is stored in the liver. And a few hours after the meal, when your blood glucose starts to go down, then the liver mobilizes this glycogen, converts it into glucose, and this glucose then provides energy for the other cells of the body. However, in cirrhosis, what happens is the liver is unable to use this glycogen stores, and the blood glucose cannot be maintained by glycogen or with help of the liver. So what does the body do? Then the body starts to break down the protein stores, the muscle stores and the fat stores in the body, and in order to maintain a blood glucose level or in order to provide energy for the other cells of the body. So slowly what happens, your protein stores are depleted, your muscle stores are depleted, your fat stores are depleted, and you lose your triceps, you lose your biceps, your skin becomes really thin, and this leads to severe state of malnutrition or sarcopenia, which, like I said earlier, is associated with very high risk of complications, very high risk of infection and mortality in patient cirrhosis, even before transplant and even after a liver transplant. So it is very important to protect against malnutrition, and this can begin in very early stages of cirrhosis, and you should follow these dietary recommendations. The most common dietary recommendations that are made is that don't stick to 3 meals per day, because as I said earlier, your blood glucose levels will go down, and it is the dietary source that will be able to maintain your blood glucose level and protect your protein and muscle stores in the body. So take 4 to 6 meals in a day instead of 3 meals in a day. Include a breakfast and a late night snack, which will help to maintain your blood glucose level even when you're sleeping and protect your protein and muscle stores. The carbohydrate intake the calorie intake should be around 30 to 35 kilocalories per kg per day, divided in these 4 to 6 meals over 24 hours. And if you are a 60 kg individual, then it should be around 1800 kilocalories to 2100 kilocalories over 24 hours. About the protein intake, it should be between 1.2 to 1.5 grams of protein per kg per day. So if you are a 60 kilogram individual, then it should be between 72 grams to 90 grams of protein per day you should consume. And again, you should not miss your breakfast, and you should have a late night snack, and in total of 4 to 6 meals in a day is what you should consume. And what should this late night snack contain of? It should contain around 50 grams of complex carbohydrates, which can be any kind of bread, and 15 grams of proteins, which can be egg whites, it could be fish, or it could be chicken. So these are the broad guidelines that are recommended by various scientific guidelines all over the world, and it is what is recommended if you are suffering from cirrhosis. It will protect you against onset of malnutrition and onset of sarcopenia, which can be very helpful in the long run for any patient with cirrhosis. Another important recommendation is limitation to less than 2 grams of sodium in 24 hours, and this is a very important recommendation that protects against development of ascites, development of limb swelling, that is edema, and portal hypertension. However, in order to maintain this less than 2 grams of sodium recommendation, the patients frequently have very unpalatable food, and what happens eventually is that patients are not taking their calorie and protein intake properly, and slowly they develop malnutrition and sarcopenia. So there should be a very fine balance, which is very tricky to achieve, but I think a doctor should be able to help you achieve this fine balance between the dietary recommendation and salt restriction. And according to the priority, I would place a dietary recommendation of calorie and protein as more important, as very strict adherence to a salt restriction. So this, as I said, this is a very tricky balance to achieve, but you can seek help from your doctor or healthcare provider to achieve this balance. However, what I would like to stress is that your calorie and protein intake is very important to maintain, so that you do not suffer from malnutrition and sarcopenia, which is associated with increased risk of complication of cirrhosis and increased risk of mortality, both before transplant and after transplant in patients with cirrhosis. So the most important aspect to remember is to not have prolonged periods of fasting. You should keep eating frequent meals, maybe 4 to 6 times a day, so that prolonged periods of fasting are prevented and your blood glucose level do not go down, and your protein and muscle stores are protected. So if you think there was important information in this video, then please subscribe to the channel and like and share this video so that more and more people can benefit from it. Thank you.